If you have neck pain, you may wonder what's causing it and how to fix it. There are many different causes of neck pain, but many exercises for neck pain that you find online or even at some doctor or physical therapy offices are often general, and sometimes they work and sometimes they don't. In this video, I'll share how to find the best exercises for your neck pain based on the location of where it hurts. So let's get started. Now, before we jump in, I should note that there are a lot of different types of neck pain, and this is an online resource, so it can't possibly cover every single type. So if these exercises don't work for you, do make sure to get it checked out in person. Now, that said, there are three different regions to your neck. You have the upper cervical area right below your head, your skull, C1 and C2. Below that, you have the mid-cervical area, and then you have the lower cervical area or cervicothoracic area. And you can have pain in any of these locations, and the treatments are quite different. Now, the most common region where people get neck pain is in the mid-cervical spine or in the muscles out on their shoulders. But most of the time, the causes are actually in the upper cervical and or lower cervical. So we'll cover upper and lower cervical problems first, and then we'll come back to the mid-cervical problems at the end because those are often fixed by the upper and lower cervical treatments. So first we have to go into just a little bit of anatomy to help you understand this. The upper cervical spine is made of your skull, C1 just below that, and then C2. C1 is kind of like a ring that spins around an axis on C2. And so the C1, C2 joint is almost pure rotation. And then the skull on C1 or the atlas has a unique orientation where the joints are kind of facing downwards and forwards like this. The net point of this is that in the upper neck, side bending and rotation often occur in opposite directions, meaning that if you lose side bending one way, that's usually coupled with a loss of rotation in the opposite direction. So to stretch out the upper cervical spine or the neck, you'll do a slight tip to one side and very slight, because if you go too far, you're now into the mid-cervical. So think about just a slight tip around your nose and then turn your head slightly in the opposite direction. So just a few degrees of rotation, slight tip, slight rotation. If you need to get a little bit of extra stretch on here, you can push down slightly and just pull over like this. You should feel a stretch on the opposite side that you're bending to. So if you tip to the right, rotate to the left, you should feel a little bit of a stretch on the left. If you tip to the left, rotate to the right, you should feel a little bit of a stretch on the right. You often do hear or feel some little pops when doing this, and often they feel pretty good. So that's one stretch for your upper cervical spine, and specifically your head on C1. Another exercise that's really good for your upper cervical spine is just doing a pure rotation side to side, trying to keep your nose going straight horizontal and not going side to side like that. So imagine an axle through your head. You're just spinning around that axle, going side to side, just through what feels easy. If you have to start to force it, you'll probably notice that you get some side bend associated, and you just want a pure rotation for C1 on C2. So that's the second exercise for the upper cervical spine. And I should note that that often manifests in headaches as well. Either headaches in the back of your head, or sometimes headaches that go up and over top or even into your forehead. Now, the third exercise for the upper cervical spine will require just a little bit of equipment. You can do this with a towel, and this towel that I'm using is about 36 inches long. It's a little larger than a hand towel, a little smaller than a bath towel. You put it around your neck like this, and then the hands here, you cross one side over, then you cross the other side over the top. This is to improve rotation towards this side. So if you're turning in that direction, that hand is the one that comes over the top. You'll pull down here and then pull across your cheek this way. So you're turning like that, pulling across the cheekbone and just trying to improve rotation. This is referred to as a SNAG, or it's an acronym for Sustained Natural Arthrokinematic Glide. You don't need to know the technical term, but you can do this at any level of your spine. To make this more specific to the upper cervical, you do want the towel hitting right around the base of the skull and then coming across the cheekbone. You can use a stretching strap or a mobilization strap like this, and that makes it a little bit more specific. So if we're going to turn towards this side again, I'll grab with this hand, reach over the top here, and you see right where this strap is hitting, you can see it a little better, hitting right across the back of the skull, coming across the cheekbone, and then just pulling across in that direction. To see that turning to the other direction, you'll grab with this hand first, reach over the top with this one, and then pull across the back of the head, cheekbone, and then turn to the side while pulling down with this one, and then just go through what feels comfortable to do. I should note that you do not want to force this because you can cause yourself to hurt worse if you do. Now, one more stretch that I should mention for the upper cervical spine is not so much a stretching exercise as much as a strengthening exercise for your deep neck flexors. They lie just in front of your throat here, and this is typically what people think of as a chin tuck like this, but you don't want to do a chicken neck motion like this. It's just a slight nod down with an axis of rotation through the ears, and you just want a slight chin nod down like that. That stretches the suboccipital muscles, the muscles right at the base of the skull. So do a slight chin nod like that, and then try to hold that as often as you can throughout the day. So I typically don't tell people to do 10 reps or a certain number of times a day. Just be aware of getting into that posture as often as you can possibly remember to. Now, if you do need a little better stretch for those muscles, you can also take your hand and put it right on the back of the skull. Take your other hand and put it on your forearm, and then pull up here while pushing down. That's a nice traction effect and stretch on the muscles in the back of your skull. Helps stretch them out a little bit better, and then it makes it a little bit easier to do that chin nod exercise. So next we'll move down to the lower cervical spine. Like I said, we'll come back to the mid-cervical because often by addressing these upper cervical and lower cervical problems, that will fix the mid-cervical problems. So the lower cervical spine, or cervicothoracic junction, is where your neck joins with the thoracic spine. And often people who have a forward head posture will start to develop a hump at this area. That makes it harder for them to extend their neck through the lower cervical spine, which ends up creating more extension in the mid-cervical spine and leads to mid-cervical problems. So you can do a snag in this area as well, and I'll get the stretching strap back out here. You put this around the base of your neck here, and you can also do this with a towel, but notice you want it hitting right at the base of your neck. You don't want it pulling in the middle part of your neck. You want it right at the base of the neck, pulling down like that. Then you're just going to kind of do a chin tuck and arch back over that lower cervical spine there. So you're trying to create extension just at the base of the neck like that. Now, another really effective way that you can do this, and I find is often a lot easier for patients to do, is to sit with a chair that has a back that's pretty high, comes up just about to the base of your neck. Take your hands and put them behind your neck like this. Fingertips right at the base of your neck, and then sit back on the chair, arch your chest up, and lift your elbows. This isn't a huge back arch over the chair. It's a very tiny motion, just lifting the chest, lifting the elbows, keeping the chin tucked to support the upper and mid-cervical spine, and then just isolating movement through that lower cervical spine. So those are really the only two exercises that I'll show for the lower cervical problems. Those work well and help address a lot of different problems in the lower cervical spine. So now we'll come back to the mid-cervical spine. This is where a lot of people start to develop problems, whether that's joint problems or muscle problems or even pinched nerves. And the reason for that is if you're stiff up here and you're stiff down there, then you move too much through this area and end up pinching nerves. You can get joints that lock up, and often that's because if those joints have become a little bit too hypermobile, they are more likely to get locked up. And that's where getting manipulations, going to a physical therapist or chiropractor often does give quick relief, but in the end you need to stabilize those mid-cervical joints. Now, to get back mid-cervical range of motion, you can again do that snag exercise or the rotation exercise. You'll take your towel or stretching strap and put it around your neck, and you're just going to change the location of it. So instead of pulling across the base of your skull, you're going to pull across the neck joint where it's hurting, and say you have trouble looking to this side, you just pull like this. But the location of the strap is lower down. It's right over the problematic segment. Additionally, your lower cervical spine, unlike the upper cervical spine, is coupled with side bending and rotation in the same direction. So as you side bend to one side, you tend to rotate to the same side, and as you side bend to the other side, you tend to rotate to the other side. So to improve mid-cervical range of motion, if you tuck your chin down slightly and then turn chin to shoulder, chin to shoulder, chin to shoulder, that opens up the joints between your neck. As you're turning towards this side, it closes down the joints on this side and opens up the joints on this side. Then as you turn to this side, it closes the joints on that side and opens up the joints on that side. If you do have a pinched nerve in your neck, doing tipping of your neck away from the side of the pinched nerve, or turning your neck with your chin down away from the side of the pinched nerve, can often take some pressure off that nerve. It opens up the spaces where the nerves come out of your neck. So that's another good exercise for mid-cervical mobility. But again, a lot of the problems in the middle neck come from hypermobility or excessive mobility. Doing that same chin tuck exercise that we did for the upper cervical, that also activates, again, the deep neck flexors, which helps stabilize your spine. So not only is that good for upper cervical mobility, but it's also good for mid-cervical stability. Other exercises that can be helpful for stability, particularly if you have problems with side-to-side motions, are just very gentle isometrics, just pushing in slightly with your fingers going one direction, holding for about 5 to 6 seconds, and then relaxing, and repeating about 10 times, and then going to the other side. Push in, just a very gentle hold, a few ounces of force, and then relax. Remember, your neck muscles don't have to be incredibly strong. They're not doing huge amounts of work holding your head up, but they have to do it all day long. So they're endurance muscles. Now, finally, what about neck pain in this area? A lot of people say they carry their stress in their neck or carry their stress in their shoulders, and oftentimes they'll develop knots in these muscles right here. A lot of times that happens not because the muscles are tight and held up like this, but actually the opposite. If one shoulder is persistently brought down more than the other, either due to carrying heavy things in that arm, carrying a child in that arm, carrying a purse over that shoulder, that overstretches the muscles on that side as well as overstretches the nerves. As a result, your body tries to protect by developing tension in those muscles to help pull it back up to its normal resting length. And so you have a muscle that's over lengthened, but chronically trying to shorten, which is where you get knots or trigger points in the muscles. So the solution to that is not further overstretching the muscle, but actually trying to shorten the muscle. Doing an exercise where you put your arms up like this, doing a slight chin nod, and then raising your arms up in the air, shrugging the shoulders like this, holding for 10 seconds, and then coming back down and repeating that 10 times is good to shorten a posturally lengthened muscle. Additionally, it is helpful to do some trigger point treatments where you release knots in those muscles. And if you'd like to learn how to do that, check out this video over here, or for more posture tips to relieve neck pain and back pain, check out this video down here. But before you go, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.